Good evening, everybody. I welcome all of you for the 23rd lecture of our webinar series. We have been hosting lectures on the Saturday of every month by scholars, by senior people who have carried out very important research in the field of archaeology and its allied subjects. So today we have with us Dr. Veena Mushrif-Tripathy. She is from Deccan College. I hope most of you know her. She is well known for her work in the field of anthropological research, bioarchaeology, you can say, and most importantly, I know her from the days of her involvement in Sanoli excavation. She has done wonderful study on the Sanoli skeletal material, even though we could not proceed much further on that. Anyways, I welcome Dr. Veena for this lecture. And she, as I told you, she is an assistant professor in the Deccan College and involved in the research of skeletal remains from various sites all over India. And she worked very closely with Professor Sir Walimbe and brought out very important publications. Many of you might have seen her book also on the most important aspects of bioarchaeology. So without wasting much time, I request Dr. Veena to proceed and deliver the talk. Thank you.
Good afternoon, everyone, and thank you, Dr. Prabhakar, Dr. Michelle Danino, and Sharda, Dr. Sharda. And it's been really everybody. I know everyone like since long time, and it's been a really great pleasure to meet you online. And okay, so I will start my work. So, as you know, my topic of discussion is, or the lecture is, paleopathology and its implications to understand the prehistoric human societies. My lecture will be divided into what is paleopathology, what are the different findings, what we get, and from how we interpret those findings into social and cultural context. And there are certain few case studies which I will be discussing about. So this is what my presentation will be regarding the paleopathology. So I work as Dr. Prabhakar has said that I worked on the human skeletal remains from archaeological excavations. So paleopathology has been a very important aspect of that studies, because it directly tells us about what happened to those people, like what health hazards or what health issues that population had during those particular culture. So it is like study of ancient suffering or ancient diseases. That is about the paleopathology. And the paleopathology talks about the long periods to pathological changes on the bones. And it is of evolution of, it is just we don't understand just the disease of these particular population, but we understand about how the evolution has taken place, how we are adapted to these different diseases over the time frame. So that is the paleopathology we are. And the main aspect of paleopathology analysis is to diagnose, but that is the first step. There are various stages, like to identify what are the problems are there in the bone or in that particular person. What are the, so that is known as a diagnosis. What is the what exactly happened to that bone, whether it's a normal bone, whether it has some pathology, whether it has some morphological variation or pathological variations. So what is the what exactly the identification of that diagnosis? The second question, how the lesion is formed, how the process has taken place, what are the bone changes, nature, what are the methods to go for the diagnosis. And conceptual framework is why the lesion is formed. So not just diagnosing the problem, but going beyond that diagnosis and trying to understand what exactly happened and why that particular disease is present in that particular time frame or in that that culture. Why? So not just identification, but trying to get the process behind it, and um, what is the reason behind it. Maybe it's some cultural reasons, maybe social reason, maybe sometime like for, if you are aware of, you like aware that after the antibiotic when the antibiotic got introduced to the human life, our health drastically changed, and we became more we became more uh, uh, we could able to adjust with the different pathologies. So but before that, what was the problem? So before antibiotic was introduced to the human societies, we were suffering for so many bacterial infections, so many viruses, so many other problems or health problems, and we were trying to just understand we are trying to just recover from this. But after antibiotic, then we changed our entire system. Health system was had a really drastic change in that. So so what are the methods for that? So one is the microscopy, means you are just observing it and seeing it. What are the bone changes you are what are the bone changes you see on the bones? And then the microscopic, like histology, scanning electron microscopy. These are the very deep studies, in the sense seeing the actually how the bone cells are formed, how whether they are in a normal cells, or they have been disease cell pattern. All those things can be understood from the microscopic analysis. Then the radiology, x-ray or a CT scan. Then bone chemistry, sometimes we get some information from the trace element analysis or stable isotope analysis. And next is the DNA sequencing. But the problem here is whether the DNA is survived in that particular bone. Well, what is there are a lot of problems of the contamination, and even the cost involved and the facility. And when we talk about from Indian perspective, ancient DNA, finding an ancient DNA itself is a hunting in the dark with your closed eyes. Okay, so you exactly don't know what you are hitting and when you are hitting. So you are just trying hundreds of bones, and then out of that, you might be there is 1%, one bone will give you DNA. And when we talk about from the paleopathological aspect, we should find a pathogen of pathogen DNA, which is much more in detail, in depth studies. Like first of all, collagen, which is where the DNA is preserved, is not properly preserved in Indian continent, because the climate plays a very crucial role in survival of the DNA. And on the top of it, if you are, say, suppose having the leprosy or the trichonoma or any other infection disease, that pathogen DNA should be survived in that bone. So it is much more a problematic situation in the Indian subcontinent when we talk. Then other sources are archaeological evidences and literature, epigraphy, iconography, drawings, and all this literature. Means our Atharva Veda, if you are aware of it, like it talks about lot of pathologies and how to deal with those pathologies. So there are certain evidences in the literature. We can get some information regarding the societies, what kind of treatment they were having when the person was having some health issues. So it has a really very interdisciplinary approach. So you can incorporate everything when you are dealing with this paleopathology subject. The problem is there are certain limitations also. So the study is restricted largely to the bones that affect the skeleton. So any bone which shows you any pathological changes, it means that it is a prolonged, it is not immediate. Like for example, corona infection, we will never able to identify whether that particular person had any kind of these kind of evidences, because the infection should be prolonged and chronic in nature. So it is not possible. So if the problem is resolved in short time, then we will not get any indication on the bones, because it is the last organ who gets affected by any pathology. So so that is and the problem is the bone, which is, I'm talking about this, the bone produce very limited ways of reaction to disease, any disease like porosity or any extra bone, or there are certain lesions, but they are only related a very few ways the bone shows its problem. You have to interpret those issues based on the spread of the spread of that bone changes on the body, but it is very difficult for so there is these two major problems are there from the bone side itself, is like they have to be prolonged sicknesses, and there are very limited ways of reaction. The second thing is like determine the cause of death is often a speculation. Like we are not 99.99% that we cannot say about how that person died. So there are very few times we can be little bit sure about like why that person was died because of certain things. So that is the main thing. And the population studied by are dead, and they may represented a bit of living population. We are not able to say about entire population, as archaeology is a archaeology itself has its inherent problem of fragmentary nature. So the bones itself, again, we don't get most of the sites, or the most of the skeletal remains are fragmentary in nature. They don't we don't have entire skeleton, and even there is an entire, they are in a very bad preservation conditions. So it becomes very difficult for getting any information through bones. So these are the major issues when we deal with the paleopathology. So other thing is like the taphonomical changes what we see on the bones. It's many times create a lot of misinterpretation, or we are not able to. For example, in this particular bone, it is because of the root has penetrated, and they have kind of taken out most of the part of the bone. So it is difficult for us to understand the morphological features, if there are any changes or any pathological changes in the bone. And so this is a cremation or cremated bones. Or so these kind of marks shows that these are the cremated bones. This is what the tooth mark of bone on the bones. So this is from particular site, is from Nagaland. These two are from Nagaland side. There is one site where you are having the pot burial, and you can see these are the nail marks here, and these are the teeth marks. So the excavator, Dr. Toshi, he said that in that pot burials site, there were a lot of porcupines were moving around. Okay, so and these are the gnawing marks, like the chewing marks of the rodents, any type of rodents. So these things also create some kind of a misinterpretation of the pathology. If we are not aware of the issues, then this might consider as one of the pathologies, or kind of leading towards pathologies, not exactly pathology. But these are the things you have to be very careful about when you are dealing with the paleopathology. So for the study purpose, we divide this pathologies into different categories. So like, for example, congenital disease, we will be going through one by one in the presentation. So there are like infection disease, trauma, joint disease, metabolic disorders, then stress factors, neoplastic or new bone formation, dental disease. These are for our own purposes. This particular like segregation has taken from, there is Archaeology of Disease, that book is there by so from there we are getting this particular segregation. So coming to the congenital anomalies, so these are the physical conditions which are from the birth, like during the growth inside the womb. So these are the certain problems we can see in the cell development and other things. And in archaeology, we don't get worse condition because it has not been preserved. So we get whatever we get. There are mild forms of congenital issues, or why when the baby is developing inside the womb. So so the changes may not lead to the pathological, but they can result into threatening disorders. So these are the issues known as a congenital. So like spina bifida. Okay, spina bifida is open spine. So this is a sacrum where this spine is open. Sometimes it can be, as I told you, like it can be a normal variation, or sometimes it can lead to some really bad impact on the health. So this is a palate has been broken here in the face. This is a staphne defect. This is a developmental issues here. And this is a trigonocephaly. Trigonocephaly means triangular head. This is from Inamgaon. So this happens when we are having these sutures on the crania, and every suture has kind of, when the one particular suture attached with other suture is a kind of there is a sequence. When sometimes that sequence is missed, then there is some odd shape of skull. So this is known as a trigonocephaly, triangular shape of forehead. This is from Inamgaon. This is from Nagaland, one side, Leshmi. These two are not from India, they are outside. So this is one more interesting of this. These are like little means less hazardous variations of spina bifida. So this is like incomplete neural arch of the vertebra. This is from Abhaipur, that side. This one incomplete foramina. So these are morphological differences or developmental issues which may not have led to a problem. This is really interesting. This is one skeleton from Vadnagar, medieval skeleton, and this is the first rib. As you can see here, the first rib, like the shape and the size of the first rib is completely different. And this is again a morphology when the baby is developing, so inside the womb. So this is the last size differences we can. So these are comes under the congenital. Infection disease are very commonly seen in the archaeological populations, and there are two main types of infection. One is known as a non-specific infection, where it is very difficult to diagnose what is the problem exactly. And there are specific infection where we know that this particular problem is because of particular disease, like for example leprosy, tuberculosis, treponema. These are the infection we know that this is what is the problem. But most of the time, most of the archaeological population comes under the infection in the non-specific category. So when we talk about the infection, like you are all aware of this corona infection or whatever we went through for last 2 years, we had to be in our own respected houses. So basically, this is how it starts happening. The first is the exposure to the particular infection, then the infection happens, and then the transmission and the epidemic spreads. So there are several epidemics happened in the past. So this is how we can, so the certain infections are from the animals, certain infections from human to human, animal to like corona or monkeypox. Now there are so many things which coming from different animals we are getting, getting these kind of infection. So this is what it has been said from the this particular paper, and this is what like frequent appearance of infection disease in the archaeological record. So this is like 5000 BC. This is the time when we are having this kind of infection disease. Then the plague also is here. Then the plague of Athens. Then so this is how the evolution or different infection diseases happened in the past. So like Black Death, which is in the later part. But when we talk about from our archaeological point, this is very important. So this is what we see in the archaeological record. If we are having the pathogen DNA or proper information, we are able to get these kind of evidences. So in bones, how it looks. So these are the certain ways the bones reacts to infection. So like these are like localized infection, the bone changes, you can see the porosity, some swelling on the bone here. This is a very interesting specimen from Nagaland burial. So you can see this is a close-up of the bone or the ulna here. So you can see the porosity, continued dense porosity, which is not a normal thing in, if you consider that the porosity which is you see in the growing bones, but this is not. So this probably resulted into some kind of a treponemal infection or tuberculosis. So we are not able to identify that. So sometimes it becomes very difficult to understand what exactly the pathology is. But there is some bone changes. You can see this is a very young child, not even a 1-year-old child. So you can see the infection is very strongly developed there. So these are the specific infection or the trip. So this is the evidence. This is the from Agripalli. This bone is been in bit of controversy. These have been described in the this American Journal of Physical Anthropology, but they are having some. This is known as a Caries sicca, kind of a Caries sicca. It is known as bone changes, and these are the bone changes from the another site called Kauthe, and this is from Jodsoma. There are certain bone pathologies seen on the orbit region, and this is from the ulna. So all those things suggest that these were something related to treponema. If you see here very closely, you can see this is known as a Caries sicca infection. Okay, so this is one site uh, from Harappan region. I don't want to say anything about the site right now because it's still a controversial, because treponema infection or these infections are considered to be a very what you can say, not seen in a proper manner. So syphilis or a treponema infection, like these are like sexually transferred diseases. Not necessary. Treponema is in general a disease, but syphilis, when you call it, it's mainly sexually transferred diseases. And these are having a lot of theories regarding when it got introduced, whether it got introduced from old world to new world, new world to old world, or whether it was present, because treponema again has different variety of like syphilis, pinta, yaws, and other things. So all those things, but you can see such a badly preserved, such a badly damaged zygomatic arch. You can see here there is a hole here, and these are the typical Caries sicca infection on the skull. So definitely it is a treponema infection. Whether we call it as a syphilis, we are not very sure about it. When it comes to leprosy, so leprosy is the infection which affects all the extremities of the body. So so for example, the this particular nasal, then the patella, then you are having the incisor area or the maxillary, all your extremities. So this is one of the uh, oldest specimen regarding to the leprosy infection, which has come from the Balatal site, which was Gwen and myself worked on this particular pathology. And in that, this is one of the also very much referred article uh, from India, like one of the oldest from the around 2000 years back, 2000 BC. This particular specimen is belongs, so belonging to that particular chronology. So oldest specimen of leprosy is this Balatan. So another is a traumatic lesions, which means that a sudden uh, accidents or something which leads to the damage to the bone or soft tissues or something like that. So this comes under the traumatic lesions. And it has been like having the sociocultural implications uh, in this paleopathology subject. So This is not exactly the trauma, but it can lead to traumatic damage to the bone. This is known as a the depression, like uric acid. It has been deposited, and because of osteochondritis, it is known as. And then this one is. As I said, that uric acid accumulation, and this particular bones are the first phalange from the toe. Okay, so that the first toe phalange has these, both are having these kind of osteochondritis lesions. This is very interesting specimen. This was the work. This particular work was published by Selva and Professor Valimbe. This is the site called S. Pappinayakanpatti. And this is from the Iron Age site, megalithic Iron Age site, where you can see there is a sword like, iron plate like, the bone of the, it was chopped. And but the person did not die immediately after the blow to the skull, because there is a secondary bone formation in this area, which means that after such a grave injury, that person remained, and this is an old individual, male individual, around 50 plus individual, and it shows that the person, this particular male, did not die immediately after the blow, but it remained alive for 2 to 3 months because of the secondary bone formation, and which also indicates that it had, the society could afford to keep such a grave injury for injured person alive for 2 to 3 months, and had some medical knowledge system available for them, because that's how they could kind of that they could try to just revive him back. But the person died because of the secondary kind of infection because of this blow to the skull. So this is very interesting. This one is known as a green stick fracture. This is a normal bone, what you see, and this is a green stick fracture. Green stick fracture means these are related to the young children. So if the young children have bones are having more elasticity because they are growing, and because of that their bones do not break easily. They bend, and if you put a lot of force in that, then only they will break. So this particular angle, what you see here, is because of the green stick. So these kind of fractures are known as green stick fractures in the paleopathology literature. These are very interesting traumatic injuries. So you can see here, this is a radius and ulna, basically lower arm. Okay, so this one here, you can see it has been really well healed fracture. Okay, so the person might have just fallen down and broke his arm there, and it got mended. Not a proper mending is happened, or not proper joining is happened, but it did not had any effect on the any, like here there is no effect, because if the bone had changed here, there should be some issues or the corresponding evidences of the joint here, but the joint seems very normal. So it is very difficult to understand the issue. Probably the bones got adjusted to that kind of a fracture. This is very interesting. This is from the Rupkund, and as you can see, the tibia had broken down, and instead of putting the bone actually came on the top of other bone. So actually this should be here, this particular point should be here, but instead of that, this has happened here, this has gone here. So which means the length of this particular bone has been reduced. Okay, and this is what the bone has a tendency, when the bone is live, it's a live organ, and there is a tendency that when the bones, they start coming closer, they start joining with each other. So that is how what our trauma also get healed. That is what the healing takes place. So this is very interesting specimen from the Rupkund. This is one more evidence, like the bridge between the tibia and fibula. So probably this was some kind of a fracture happened, and then they started, there might be some bone bridge started forming, and that you can see with this particular specimen. This is very interesting specimen from Rupkund. This is a anti-mortem blunt trauma. To, as you might be aware of this Rupkund Lake, which is the high altitude lake in Uttarakhand, and the lake is frozen throughout the year, only at least only for 3 months to 4 months, like May, June, July, and August sometime. It melts, and the skeletons which are around this lake, they get exposed. So National Geography had made the film, and Professor Valimbe was taken a lead to kind of understand these particular very interesting specimens, why they are lying around there and other things. So I was also part of that work, and we could identify there is like these kind of anti-mortem fractures happen to the skull. So this is there are folklore which states that the population went there and they got trapped in that area and they eventually died. So this one is in that documentary we said that it's a hailstorm came, and the cricket ball sized hail was fallen down on this particular population, and many of them died because of that. And earlier it was thought to be a one-time event, but the recent paper, what was published by David Rai and a group, I am also the co-author in that, which is it had a multiple events, not a one event, because you see hundreds and hundreds of skeletons are lying around the lake, and which is very difficult to identify it's a one-time event. So this is very interesting specimen as well as the site. So coming to what you can say, the next is like joints or the typical osteoarthritis problems what we see in the joint, like related to old age population, when you are having the joint diseases, lot of arthritis, spondylitis and other thing. So these are the things which are being like, which can be so including slipping like bony spur, osteophytic growth, marginal to articular surface. Articular means where the joining surface, like the breakdown. So what are the three major components of the skeleton? So the breakdown of the articular cartilages, and then you are having the reactive bone formation, which kind of starts taking like the bone starts coming to closer to each other, close to each other. So this is what is the joint problem. This is a mandibular. So you can see the joint, wherever there is a joint, there is a problem. There can be a problem of arthritis. Like this is a mandible joint where our mandible is articulates with the skull. So when you are eating with forced food or very forced, you are having forced bite, or when you are eating very rough food, tough food, then sometime it can also happen there is a fracture or there is small bone changes happens where the mandible is attached to your skull. Then this is these are known as a temporomandibular joint issues, TMJ. It's very well known in the paleopathology literature. This is the atlas and axis, and which shows that they are having the bone changes here. So basically this is where the skull is articulates. So here, and this one is the skull where it is, and this is atlas and axis. Axis is this one, so where the bone rotates or the skull rotates around. So this also shows some kind of arthritic issues. Then this is a vertebral body, and there are a lot of heavy bone lipping or osteophytic growth, what we call, is seen, which is not a normal condition. This is again this is a pelvic bone, which is the acetabulum, where the femoral head is articulates, and this is knee joint. Okay, you must have seen that, you must have heard also that most of the old people, they complain about knee joint problem. So basically it that happens, like there is a lot of bone changes found on these. So this is a femur, then this is patella, and this is a tibia of one person. And here generally when it happens today in modern societies, modern treatment system, when somebody has a knee problem, they kind of cut or slice this bone, put the metal cap on it. Again, here they cut it and put metal cap, and then they put the fibrous material here. So what happens? The bone do not, scratch each other. So there is a problem when the bone starts coming too close to each other. They can create lot of pain in the joint. So just what they do is they put the plate here to avoid that contact with the other bone. So this is before that treatment. So this particular person might had a lot of knee pain when that person was in moving his leg. So so this one is that. Then the metabolic disorders. Metabolic disorders means when the normal cell is growing, it stops because of certain health issues, certain like illness or certain malnourishment. Like so, the normal cell growth stops, and once you recover from that, there is a again it starts. So what are the indicators in skeleton? So these are low as vitamin D deficiency disease or rickets. So vitamin C deficiency, and it is shown in the case of like enamel hypoplasia, Harris line, osteoporosis, Paget disease, and all these things are the indicators from the bone where we can identify certain malnourishment or certain metabolic disorders. So coming to that, this is known as a iron deficiency anemia. As you see here, this is a young child which has a very densely porous texture of the skull. So earlier, and this is also known as a cribra orbitalia. So this is also one of the indicators. So this is the orbit surface or top of the roof of the orbit. And as you can see, there is a dense porosity in that. So this is considered as a iron deficiency anemia. And now they are telling that these also can be interpreted from the thalassemia as well. So this can be one of the indicators of thalassemia. So it is very interesting to know that this particular people had gone through these issues. Then this is known as a enamel hypoplasia, localized enamel hypoplasia, and this is known as a Harris line. So enamel hypoplasia means when the normal, so this white thing what we see in our teeth, they are known as a enamel, and inside that there is a dentin. So every tooth forming has calendaric sequence. So we know that how when the tooth starts forming, when the tooth is completing its crown. Okay, and this is a during that, if the child is sick and the normal cell growth is stopped, then these kind of happens on the teeth. So we know that exact what time this child was sick. So this is known as a localized enamel hypoplasia. The Harris line, this is an X-ray of a subadult individual. And as you see here, these are known as growth arrested line or recovery also. Sometimes it is said that this is X-ray. In that X-ray, we find these kind of less dense lines. It's known as Harris lines. And this tooth and this bone belongs to one child only. The child was not more than 1 year. And according to the tooth development and where the lesion has started, on that basis, we can say that the child was most likely inside the womb of a mother where the problem started, and it might have led to the death of that particular child after the child was born. Okay, so this can be also deal with. So we can interpret that maybe the mother was not able to give the nutritious food, or she was not able to, as she was not well fed and she was not healthy, obviously child may have had the impact of that. So, and eventually that child diet. This is also the porosity. This is known as a scurvy or vitamin C deficiency, where the jaw has having extreme porous bone. So it probably relates to the bleeding gums, what we see, the blood. So it is known as bleeding gums. So it probably related to the vitamin C deficiency. Then the stress factors. So they are known as a habitual stress markers, occupational stress markers, which can tell us about the kind of activity the skeleton was going through. And these are the activity induced changes in the skeletal body. So like for example, this is a very interesting specimen from the Nevasa. So this is known as a maxillary sinusitis, and this is a depression of on the maxillary floor. And this particular maxilla belongs to a female, around 18 to 20-year-old female from Nevasa. And what could be the reason behind it? Like these are, when you see the paleopathological literature, it shows that when you inhale impure air, like using biofuel or anything, because of these kind of activity, then you inhale a lot of impurities, and because of that you get this kind of, these are like sinuses or the empty spaces in your skull. Like there are 5 empty spaces in our skull, like one on the frontal near your above your eyes, one in the nose area, and on the 2 on the maxilla, your upper jaw, on the top of your upper jaw. So this is what we are talking about. So this can be also how we can interpret that from the cultural point of view. Like people who are working in these kind of situations can have a bad impact on the health. Okay. So this is the occupational hazards, or what we can say the stress markers. This is known as a squatting facet. This is a tibia, lower leg, what we say. And when you sit in the squatting position, like for just for chit-chatting and do some occupational activity like pottery making and other thing, there is a extra facet. It happens here in the tibia on the in the front. So these are known as a squatting facets. So we cannot sit like this now, because we are not, our body is not tuned to sit like that. But earlier the population were used to sitting like that. So they were having these kind of squatting facets on their tibia. Then as you can see here, like the clavicle, what is the clavicle, like what there is a like these kind of a bone development or markers on the bone, so which tells us there is a lot of activity happened in the joint, the collarbone. Basically what I'm showing you is a collarbone. So these kind of activities, like grinding grains, or you can carrying a lot of loads on the shoulder. Not this exactly, this has impact on us different, like on your skull, but these kind of activities which is a repetitive, which is chronic again, which you are doing for years together, can lead to the spatial adjustment within your body to cope up with the stress or cope up with that kind of activity. So these like girth difference between the arms, so you are aware of, if you are aware of that, the girth of one bone to other is different in the most of our cases, so it can be seen as well on, so theoretically it is possible to talk about whether some people are left-handed or right-handed, because it's all related to, if you are right-handed, obviously you will do most of your activity by your right hand, so the more muscle marking area will be on your right hand. Sometime if someone is doing left hand, then there is every possibility the left hand will be more robust than the right side. So this is, we can theoretically we can tell, but then for that properly preserved individuals, then we will able to tell something about that. Then the neoplastic growth or the neoplasm, which also there are 2 types, malignant neoplasm, which has uncontrolled local, like malignant, like cancerous Okay, there are certain which osteoma, do not have any issues, health implications to it. So, for example, these kind of osteomata. So these are like, there are certain buttons-like features on the bones which are there, but which do not create any problem during the lifetime of this particular individual. So that is not a problem. Even these kind of spur-like development, it may not have any health implications on this. They are there as example. But for example, these kind of tumors, okay, which is like cancerous growth, uncontrolled growth on the skull. This is not from India. This entire thing is not from India, but this is just to show you some example about how what I'm talking about, the new bone formation or neoplasm kind of development of the bone. So these are the cancerous bone growth within the body, which is a really dangerous thing for the individual. So dental disease is like a large section of pathology which gives everything about teeth, like from enamel hypoplasia, caries, periodontal disease, anti-mortem tooth loss, and everything. So I will show you few of them so that it will be easier for you to understand. So this is known as a tartar accumulation. Okay. So this tartar accumulation is like, it's a kind of a cementum. So after it gets very hard, and when your teeth are dirty, you go to dentist for cleaning it, and the dentist has to use a small drill to cut those tartar or cementum. And these are very good informants for us, because if we have a good sampling of this tartar, then we can kind of understand or guess what is the individual diet of that particular person, because it is a food which gets accumulated. So we can say that whether it has more, it depends on the chemical analysis, micro analysis, we will able to identify the individual diet of so it is good for us, but it is sometimes a problem. Then this is the dental wear or attrition. This is from the anterior, means your incisor, the front teeth, and this is your the wear and tear of your molars. So this has been very interesting. Like it tells you about what kind of food that person was eating, what side the preference of the food intake. And so these are very interesting for age estimation also. These are very important criteria for age estimation. This is a dental fluorosis. Actually, this kind of reddish oranges are coloration is happens when the person is drinking the highly fluoride water, and it is exposed during the lifetime, okay, during the growing age. So on the basis of these black patches, we can identify uh, whether how the water was available, what kind of water was available to the population. It is not only just shown as a discoloration of the teeth, but it can, the large amount of fluoride intake can damage to your brain and damage to your body, skeletal body also. So actually, Michelle, I wanted to know whether the Raman is still working, or is it in a working condition, so that we can do the micro analysis of this and we can say whether they are really fluorine thing inside it. So if it is there, it will be really interesting to understand where the people were exposed to fluorine in means large amount of fluorine in Iron Age time. So it is really interesting topic for this thing. So these are the periapical abscess, caries infection. Caries infection here, as you can see, the entire half of the tooth has been damaged, and there is a pus cavity happened here. Okay, so as you can see here, there is a close-up of the caries, and this is the pus is coming out of it. So basically what happens is when certain bacteria invades that because of the food accumulation and other thing, and they kind of start eating the crown, and because of the secretion of the chemicals what they do, so because of that, the crown starts damaging, and then the dead cells of it starts coming out. So these are the pus cavities which are coming out. Here also you can see these are known as a periodontal disease or absence. So sometimes what happens is, because of these kind of a pus cavities, the tooth are get loose and it falls down. So it is known as, again, anti-mortem tooth loss. So when you are having the anti-mortem tooth loss, it is not necessary it belongs to old individual, but it can be also because of these kind of periapical abscess or the cavities within the teeth and within the bone, which might have led to the anti-mortem tooth loss. There is a hypercementosis, means the thickening of the root here. Okay, so this is very interesting case. This is a very controversial case of dental surgery of official stress. So there is these kind of a markers are seen on it, and the person who studied this particular, they thought that this probably relates to some kind of a dental surgery to it. So this is again a very controversial topic. So this is not exactly relates to the paleopathology, but these kind of a changing the shape of the skeleton can sometime, or some on certain bones, can be given for like the social status as well. Okay, so like like these kind of conical heads, like from the childhood they start kind of strapping the skull or the head, so that it can create, they can be like becomes conical in shape. And this is known as the current population from Thailand, where it shows that long neck Karen. So it feels like the long neck has become long, but instead of that, the clavicle or the shoulder blades have gone down, because this is the normal X-ray of a normal person, and this is an X-ray of a long neck Karen. So basically, this is the tribal community from Thailand, where you have to go and pay the money to take photos and other thing with these populations, and they wear these brass rings. Okay, and these brass rings are 7 to 8 kg. So this particular person is wearing that continuously. So because of the heaviness, the shoulder bones goes sorry, the shoulder bones goes down. Excuse me. And it looks like the length of the neck has increased. So these are the skeletal modification happens because of certain cultural practices. Reconstructing the past. So what I have said about everything, we need to reconstruct the past on the basis of the pathologies what we are seeing. So this is a general a kind of plan of any excavation, Chalcolithic, Neolithic, Chalcolithic population. So you are having the crowded village, you are having houses very close to each other, and the population living in close contact with each other. So like this, probably this might be the kind of villages we are thinking about when we talk about Neolithic, Chalcolithic time frame. So here practices where the animals are also very close with the people. So there are a lot of diseases which was introduced by animals to humans, and then these kind of things. So can we use these pathological evidences to reconstruct the living conditions, the living conditions of the Neolithic, Chalcolithic population, these kind of villages, or like what kind of hardship these people have gone through. Like this is very interesting photos, for example, for fetching the water for the people, like drought, how they are adapting to the drought condition, how they're like there are very small water resources, and like hundreds of people are getting that water for their drinking and other purpose. So sometimes these water contains very high fluoride or very heavy metals inside that. So but because it is not available anywhere, these people are forced to drink that whatever water is available. So it can also lead to lot of health hazards with the living population. So can we talk anything like that to understand the past population, like the pastoral communities always surrounded with the animals and kind of things. So can we understand their life ways through the pathological findings, or these kind of agriculture community? So these kind of agriculture community always in the they have to be in the field, and they have to do work in the water and other kind of things. So a lot of bacteria and all those things can get into their system because of these kind of working conditions, or these kind of these kind of occupations. So can we anytime talk, are you able to understand these practices through the pathological findings, or using water resources, how we are using the water resources? Like, for example, at one place many people are doing washing their clothes, washing themselves, drinking, the animals are also being cleaned and everything. So what kind of water resources available for that societies, and how it has been used, how it has been not utilized? So all those things can be understood using the pathology. So when we talk about what you can say, the domestication and other thing. So early agropastoral communities, and these are the where we are talking about the area when we talk about the archaeology, like Harappans or Neolithic, Chalcolithic community we talk about. So that is the time when you are having the early agricultural population, as well as you are having the copper. Then you are having the domestication also in some of the little earlier, not exactly during the Harappan, but yeah. So lot of things are happening in this particular area. So the population has growing since that. So because of the population growth rate so became high after the early agricultural from the early agriculture. So the infection rates also went according to the on the higher level, because it was very easy to spread certain infection to each other in the crowded places, in the unhygienic conditions places, and with not having the proper medical system. So coming back to that, so we understand this, but I will not go into much because I have to talk a little bit better. But generally talking about, like, because of the change in settlement pattern, there is a decrease in the population mobility, and you are having the density, population density. So it created a very good environment to spread the infection, spread the anomalies to each other, not infection, basically infection. And because of the food change in the food habits, you are having the poor quality food during the Neolithic, Chalcolithic period, which led to the malnourishment. And infection, disease and malnourishment, they are the synergetic relationship. When you are eating, when you are not able to, when you are eating malnourished, or the carbohydrate based food, then there is every possibility your body is not fit for fight any infection disease. And when you are having infection diseases, even though you eat a good food, it will not get digested into the system. So these are the certain issues when we talk about the Neolithic Chalcolithic transition, from hunting gathering to Neolithic Chalcolithic transition. So there are few studies I would like to tell you about. This one was from the 2011, this paper was published, and this is from the Harappa. So these are the blunt force traumas and unhealed traumas, what we saw in the, and we try to interpret this from the perspective of the later Harappan, when the population was the culture was disintegrating, and it had a lot of problems, social problems. Can we identify this through the traumas and the pathology from Harappa? But there are some limitations of this paper as well, I will tell you. And this was again the same Harappan population we used for understanding the social tension between the Harappan population. For this, the problem was like, the whatever for the pathologies and traumas, we use only area, mainly from the area G individual, where it is like haphazardly kept, all the bones were there and the skeletons were haphazardly put and in the ditch. And that's why we could the percentage, the kind of evidences we got, which might be very less in the sense the percentage wise than in comparison when we talk about the Harappan population. Because when you talk about Harappan population, we are talking about thousands of population, thousands of people, but we got a very few evidences in that manner. So whether to extrapolate that data, which has a little bit of problem. So this one I have talked earlier, like about the bilateral pathology of the leprosy. This one. So this is the paper which we published in 2009. This is the lead and lead. We did the analysis, strontium and lead, and we could identify early age migration from site called Farmana. And Dr. Prabhakar was involved in the Sanoni material regarding the same, like the migration, early age migrations using the isotope data. So this one. Then this one we did on the Parsi population of Sanjan, did the ancient DNA. But this is again, as I told you, like this is medieval skeletons. So we got ancient DNA. But when we talk about Harappa or later period, even Neolithic, Chalcolithic, it is very difficult to identify the ancient DNA. But in this Parsi population, we can, as you know, that Parsi population is very it's a one group. They don't marry outside their Parsi population. But in this, we could identify 6 specific admission, like the local woman's was present in the DNA of local women. So basically, it's like there is a mixture between the local population and the Parsi population. This one is that's what I was talking about, the Rupkund. So we could identify different populations at different time frame in the Rupkund area. So this is particular glacial lake here, and as you can see, there are a lot of bones here spread all over the place. This one was, we did the stature estimation based on the DEXA scan, and we could identify. This was published, and this is the first time what we could identify. We could had stature estimation formulas for the Indian population, because earlier it was for the stature estimation formulas are present. They are mainly based on the white population, and this was first time we could do it for the Indian population. Then again, we try to understand the body mass predictions based on the DEXA scan using the neck width and head width, and these are the different things. So we could identify what was the lean body mass in the Indian population. Then, okay, so when we talk about the priority base, so we have to do, like, we need to have a lot of input from the medical practitioners, like diagnosing lesions, and we should have a consultancy panel for that. Then establishing the central registry and photographic radiographic catalogs for paleopathological diagnosis, because certain times what happens is we generally depends on the pathologies which are extreme in condition. Okay, we don't have the beginning stages, because any paleopathological literature, you see, they are in the beginning stages. They don't show any beginning stages of it. So it becomes very difficult, because not necessarily every skeleton can show the extreme cases. So that needs to be actually understood. Then the standardized methodology of describing the lesions. Then identifying forum experts from archaeology, biochemistry, genesis, then the ancient history, culture, like literature, and basically literature, which gives us some very good information regarding the pathologies experienced by a certain population. So I think so I'm in time by 5. So if you have any questions, So you can ask me.
Thank you, Dr. Veena, for a wonderful talk. It was really good to see so much of data accumulated or compiled together in one lecture. Really mind-boggling, and I learned a lot. Frankly, listening to you, and you have indicated so many factors and analysis that is possible looking into the human skeletal remains, which we normally tend to kind of neglect. So I hope many people will be interested to take up this kind of analysis and particular discipline. I hope some of the students listening to this develop some interest in this area also, because we lack experts in the Indian context today, and we need more and more people taking up multidisciplinary studies like Dr. Veena is doing. So now I request Sharda to take over and moderate the Q&A session.
Okay, thank you. So I request the participants to type their questions or comments in the Q&A box. I see that some of you have already done that. And I will begin with the first one, which is by Purva Salvi. She is, in fact, an ex-Deccan College student. She did her master's from Deccan College. She's now doing her PhD here. Purva asks, thank you. First, she compliments you and thanks you for such an informative lecture. And then she asks, you had mentioned that iconography is also used as a method in the beginning of the lecture, right?
Yes.
Iconography, epigraphy, and other archaeological evidences. So may I know what role iconography can serve in this particular topic?
Okay, so it is very interesting question, because like we have like humpback, some iconographic representation of humpback, or sometimes you are having like, in paintings, ancient paintings, you are having, blind people, or sometimes you are having some kind of crooked nose, or sometimes like fractured or not exactly limping person, or something like that. So these are like some indication, like in certain temples, you are having the evidence of giving birth, woman giving birth. Okay, all those things. So these are the kind of information we can get it from the iconography. Not, I'm just giving you a few examples, because outside India, like in Maya architecture and other things, there are a lot of like these kind of sculptural evidences are there. In pottery also there are like, certain evidences are there with the handles and other thing, like crook, like humped, basically the back and other thing. So these kind of evidences, if we try to get a lot of information through that, it will be more useful for understanding the some kind of anomalies, basically.
Yeah. So the next question is by Jhumur Das. And the question is, you mentioned about the problem of finding preserved bone fossil in Indian context for DNA analysis. So what is the oldest evidence of bone that we have found from India for DNA analysis, and how far has the analysis been accurate?
Okay, that's a good question. Very contrast. Okay, so recently the question, the Rakigadi has come up. That is one of the oldest DNA what we are getting from Indian context when you talk about India. Before that, we don't have much of related to humans, basically. But the problem with that is it is a good way, actually not exactly, it's a good beginning, but it cannot remain as the ultimate thing. We need more and more data to come to certain conclusions, because as I read that paper and as I understand that paper, I think so the authors are talking about one specimen itself, which might be not a good sample to talk about entire population or entire civilization. So it is always better to have a good amount of data coming from the any set of evidences, even from paleopathology also. We cannot talk, we generally try to avoid talking about making it generalized if our specimens are a few in number. So same things applies to ancient DNA or any analysis. Like we need to go for, and as I'm telling you very sincerely and very all the time, I say that getting ancient DNA data from India now, means present, whatever we are having technology, it's not possible. It might improve the possibility after maybe 5 years, 10 years, when how the technology is developing. But right now, currently, it's extremely difficult, because whatever I have got DNA from, like what I'm involved in, like Sanjan, Rupkund, or any, they are medieval period. They are not more than thousands of years old. So only just one specimen, one site we are getting the DNA. So we have to be very careful when we are trying to generalize that. So I think so I have answered that question.
Yes. So I have a follow-up question regarding that. So
Yeah.
I understand that it's perilous because we're only talking about one specimen, and then we are talking about the ancestry of that one specimen to DNA. But was there any attempt made to kind of substantiate or support that DNA analysis through any isotope analysis? For example, if strontium had been done on the same specimen, then it would indicate as to the provenance of that skeleton, whether that female had lived, that her whole life span was spent in that particular site, Rakhigarhi, or maybe her childhood was spent in some other site and then she married and came to Rakhigarhi. So was any strontium analysis done on her besides DNA?
I think so. They are trying for the strontium analysis. They have not published the paper till now. But in Farmana and Sanoli, I guess Prabhakar will agree. Like we have done that strontium analysis and late analysis, where we are trying that early age time the population was moving. So at early age they were somewhere else, and they moved later on to these particular sites. So that is there. But again, if we are talking about size specific, we are not talking about the Harappan specific as such. When we talk about Harappan specific, we are talking about large geographical areas and large number of population, variety of population, different types of population. In the sense, I'm not talking about racial, but obviously there was because it's when we call them as a metropolitan cities. Obviously, there will be people coming and going from different areas for trading and many other purposes. So definitely there were multilinguistic, I don't call it as religious, but multi-faith believers and other things. So there is everything, but isotope analysis they have done on two sides.
From DNA, they're not just knowing about that one individual, but also the forefathers and
yes. They are talking about mainly the ancestry. They are not for that particular person, that whether that person moved from one place to another, but the ancestry when we call it all together.
So Jumur has another interesting question. It's about the canine teeth. It can be differentiate between vegetarian and meat-eating population based on the sharpness of the canine teeth, and how far it's accurate if we do so.
No, it may not be the right thing. No, it may not be right.
So if you're eating meat, then the teeth are sharper, or if it's vegetable.
No, it is not possible. It is not possible.
Yes. So the next question is by Shikha. She asks, is it possible to identify through skeletal study about the impact of climate change or drought-like situations on the local population to understand switching of subsistence patterns? Can we do comparable studies between paleopathology and lipid analysis?
Okay, talking about the climatic changes and adaptations and skeleton, these studies has already been done on Inamgaon and especially Deccan Chalcolithic, when we talk about the later Jorwe period and how the population has moved from and how the subsistence strategies has been modified to accommodate climatic changes. So that work is been done. A lipid profile is not yet been done on the related to climatic changes and adaptation. So it is not been done. But these things is done on the Deccan Chalcolithic, like around 1500 BC, around 1000 BC, there is a drastic climatic change when we see in most of the places. How the subsistence pattern changed and how we are having the infant mortality rate is increased, how the population is more, going away from, like, kind of, spreading some other places because they have to, like late Harappan specifically, like how they are moving towards different areas for the water and food procurement. So this has been done very well in the archaeology.
So related to this, there is another question by Anand Devskar, who asks, are there any osteopathological studies for from the food content point of view in the Indian context? So for instance, can we know the diet of the ancient humans, like C3 or C4 plant-based diets, or marine diets, or plant versus animal-based diets?
Okay, so we can do these kind of analysis. The work is still in progress, but C3 and C4 plants, like we are having a lot of millets intake in the, because it shows like when you are there is a drought, or when there is, like, you will go for the millet based, like where you like the crops which require less water. So it has been done with, I think so, Ayushi is doing that work recently. So she's involved in that. So, but it has been said that because archaeobotanical evidences also, direct towards that we are having more the food intake, or kind of botanical evidences tells about the crops which are good for the drier climates. So it is already been done. So I think so.
Okay. The next question is by Shilpa Wadekar. She asks, can you throw some light on consuming bone marrow by the ancient humans? So any evidence of bone marrow consumption? And does it have any significance?
I think so. You will able to answer that question, not me.
There is lots of evidence of bone marrow consumption because they butcher the animal bones for their marrow, which is also extremely rich in nutrients. But in case of humans, I don't know, tending towards cannibalism, perhaps.
No. We don't have any evidence of cannibalism, so we can't say anything about it.
Yes. Okay, so the next question is by Shrishti Ghosh. So she asks, she thanks you for this lecture, and she says it was very informative. So she asks, do the elongated skulls and the vertebral column affect the lives of the people much, like their mortality or any form of disease that they might have, that normally the common population might not have?
No, elongated skulls will not have any impact. Though if the vertebral column, like Spina Bifida kind of a thing, it might, if it is more large, so our neural cord will get exposed to some kind of infection. So that might lead to some kind of a problem to that individual. But elongated skulls, no, it's not possible.
Okay. Let me. So there's one last question which I see here. Shikha asks, have you come across any example of ancient shamans who were using some kind of psychedelic plants, and if these plants had any impact on bone or teeth? Any kind of plant extracts that were used on maybe for medicinal purposes?
Medicinal purpose, no, because we haven't done much work on the Tartar accumulation, the chemical analysis of the Tartar accumulation, not yet been done. But outside in Neanderthal Tartar accumulation, though they have found some medical plants remains in the Tartar. So it might be available, but we haven't done it.
And you had a question about Raman in between, right? So I just wanted to quickly tell you that we do have a Raman spectroscopy of a certain wavelength range. And we are in the process of acquiring another. And so last year, just for trial, I had tried to characterize modern bone with this Raman. And initially, the sample got burnt because the exposure time was very long. And the wavelength that was referred was given in the literature was not the wavelength that we had used, and so we had to tweak the exposure time as well as the wavelength range in the equipment, and then we were able to get, just for the modern bones, we were able to get some spectra, but after that I did not follow it up, and I did not see if this wavelength, if the spectra gave us any information about the preservation of collagen and the different amide types. So I left it at that because I just wanted to see if this Raman is conducive for our studies or not. And for the new Raman that is being planned, by the institute to acquire, we are trying to make sure that our requirements are also taken care of through this. So the wavelengths that we require, which is mainly in the IR spectrum, that will be present. So hopefully, maybe it will take some time to acquire and install the instrument.
Okay, then I hope that we'll then come back. I will. Please let me know if it is working, so that I want to try that fluorine component in the tooth. So
that will be very interesting.
Yeah. Okay.
Because very, very minute quantities will be required, and then very fast actually.
Yes. That's what is very interesting, and not only just knowing it, I want something, a kind of an interpretation about it, in the sense whether that is there or not. Like, we'll get some spikes and everything, but that needs to be understood.
Yeah, exactly.
Yeah. Okay.
So I think and there's one last question, which is also quite interesting. So I'll take it up. It's by Vijay, who asks, how much of a difference is there in terms of bone density when we compare ancient and the current populations?
Okay, it's a really interesting question, because when we talk about the bone density, it is reducing. There was a paper, it shows that where it was mentioned that we are become couch potato. The name was said that, okay, because we sit, because our bodies are built to run and go to different places. So now, because we just come and sit and eat potatoes, chips, probably that from there it has come. So our density of the bone has reduced a lot. So it is true that our bodies is being modified and changed, and it is becoming more delicate in comparison with the earlier population because of the inactivity towards, inactivity. Basically, it's true.
Okay, there's one last question. I just saw it.
No problem.
It's by Cherian sir from Pama Research Institute.
Oh, Cherian sir. Yes. Hello, sir. How are you? Yeah.
So he asks, is there any reliable studies on the general health conditions of early historic populations with any other phases? So how many samples you or Deccan College has studied in relation to the general health status of the early historical period? So he gives a time bracket of 5th century BC to 5th century CE. And so within the different phases of the early historical period.
Okay, the problem with the period what sir is talking about is when the cremation was the major way of disposing the dead. So, and in archaeology, we are not having much of the evidences. Hardly 2-3 skeletons here and there we are having related to this particular 500 BC to. So it's very difficult. Like there are, like in Kodumana, there are 2-3 skeletons belongs to early historic phase, or there is one in some places, and some very sporadic. When we talk about these kind of sporadic findings of skeletons, we will not able to tell you about one particular population, because it is not represented there. So even though if I have Padri, which is early historic, or Kuntasi, which is early historic, but there are two, three specimens like that. So which is not a good way of interpreting the population in general. So unfortunately, we cannot talk about early historic, mainly because the skeletal samples from India, the major skeletal samples in India comes from the Neolithic, Chalcolithic, and after that, the Harappans. So the evidence itself is a problem later for the later period.
Another small question. I think after this we'll close the Q&A section. So this is again by the participant Vijay, who asks, is there any possibility to study the bones to understand the kind of sports or war games that they could have been involved in?
No, it is not. We can identify just if there is some kind of a trauma or something like that, but not exact activity. Mm-hmm. Sometimes, most of the time, 99.99%, it's difficult. Okay.
Okay. Thank you so much. Yeah.
Thank you so much. It was a very good presentation, and I would request Michelle, if you have any question.
Actually, I don't really have a question because you've already thrown so much information at us and shown how much information can be extracted from the bones. I was just reflecting on, the vast collections that Anthropological Survey of India is holding. And I was simply wondering how much of studies have been really done on all the bones which are available in India. Is it a substantial proportion or a very small proportion? What is the potential of the discipline, basically? If we had more people capable of studying human bones, could we get more out of this?
There in India, I tell you, Michelle, there are around more than 200 sites which are provided human remains, okay? Whether they are fragmentary, whether they are complete, another thing. But unfortunately, not more than 50 are being studied anthropologically. So there are huge unstudied, unrecorded. There are like a lot of skeletal collection at different places in India, like Anthropological Survey of India. I think so. After say 1975 or 70s, after they have not published much data on the skeleton. So most of the things are unstudied. There are a lot of state departments, archaeology department, they have the skeletal collection. ASI also have a lot of collections of skeletons, but unfortunately it has not been dealt with anthropologically. So we need a kind of a big force to study this if you want to have the potential itself is a huge. I don't know how to put it, but it's like if you really have certain certain parameters, really we are having a lot of material. Like in outside India, they actually struggle for the material. But here, even though we have it, we can't make out of it. So it is unfortunate that it's not been studied. So there is a lot of work to be done.
But will the collections remain in terms of, condition of preservation of the bones themselves? Are we properly equipped to preserve them for posterity if after 20 years, 30 years, or will they crumble eventually?
They will going to crumble eventually. They will give up because the kind of conditions in there they are being stored, it's not very ideal conditions. Yes. So they will go in, but not like 20, 30 years, maybe around 50 years or so. Right. They might, if you don't pay attention now, it will go into dust, most likely. So we have to be very careful about it.
So let us hope that some bright young scholars will emerge in this discipline.
Yes, and the collections where they should be open for these scholars. The problem is that we don't know.
Yeah. Yes, that is
that's the whole thing.
A systemic problem.
Yes.
Thank you so much.
Okay.
Veena, thank
Thank
you
you.
for this.
Thank you, Veena, for this wonderful talk, and I also thank all the participants for attending this talk, and I do hope that they will turn up again next month. Next month, we are going to complete 2 years of our journey in conducting this webinar series, and hopefully we'll be continuing even after that. So now we are embarking into various technologies used in archaeology, and hopefully we will try and invite scholars who work with a multidisciplinary approach. So thank you, everyone, and I
Thank you.
thank Veena, Michelle, and Sharda also. Bye bye.
Thank you so much. Thank you so much.
Thank you.
Yeah. Bye.
Have a good weekend. Bye.
Yeah. Bye.